Good
Today
morning.
we have with us Dr. Srivatsa H G, Consultant Surgical Oncology, and Dr. Divya, Consultant Histopathology. So we are going to talk about frozen section and how it influences decisions in surgery. So, sir, first question to you: how often do you face a situation where the diagnosis is not made before the surgery?
I can start with examples. The common example is a breast lump, where it is too small to biopsy or identify the diagnosis prior to surgery. In such situations, we would subject the patient to surgery, resect the tumor, and send the specimen to the frozen section lab. This is where the pathologist comes in and gives us a diagnosis so that we can proceed further with the oncological surgery.
Sir, how often does this happen? How often do you do a frozen section?
If I have to say, at least 1 in 10 cases. Another example I can give you is an ovarian mass, where the radiological diagnosis has not been helpful. So in such circumstances, again, a surgical resection would help, and the same specimen is subjected to the frozen section. And through the diagnosis, if the malignancy is confirmed, then we go ahead and complete the staging laparotomy as for ovarian cancers.
Sir, do you think during surgery, pathological diagnosis helps in decision making?
Absolutely. As I mentioned, these two cases, a breast lump which was not diagnosed by a biopsy, and ovarian cancer, ovarian lump masses which were not diagnosed pre-operative. These are the two situations where I can rely on frozen section diagnosis for my decision making on surgery.
So, ma'am, sir mentioned about frozen section. So, what is frozen section? What happens in the lab when the specimen is sent during surgery?
So, during surgery, when the patient is still under anesthesia, the surgeon removes tissue from the patient and sends it to the histopathology lab, taking care that no fixative is added. Only then we can perform a procedure called the frozen section procedure, which is otherwise called cryosectioning. So, the pathologist examines the specimen, cuts sections from all the relevant areas, places them on what are called the chucks. So, the histotechnician will come, take the chucks, put a compound called OCT, which is called optimum cutting temperature medium, and then freezes the tissue at minus 20 degrees Celsius inside a machine which is called the cryostat. The histotechnician then proceeds to cut thin sections from the chuck or the frozen tissue, and then takes them onto glass slides, stains them using the hematoxylin and eosin stain, and then submits them to the histopathologist. So the histopathologist will next examine these frozen section slides under the microscope and report the findings to the operating surgeon. So this whole procedure may take anywhere between 10 and 30 minutes, and depending on the number of sections we examine. So what are the answers we get from this frozen section procedure? Whether the tissue removed contains a tumor or not. In case there is tumor, whether it is benign or malignant. In other words, is it cancer? In case it is cancer, whether adequate surgery has been done and a margin has been given. This helps in deciding whether or not further surgery is to be done. In case lymph nodes are sent to us, whether the lymph nodes contain tumor which has spread from the primary site. That will help in deciding whether or not further lymph node removal is to be done. Rarely, it also helps in enzyme studies.
So, ma'am, what is the efficacy of a frozen section? How confident are you when you're reporting a frozen section?
Now, this will depend on the quality of the cryosections. That in turn will depend on the skill of the histotechnician, the efficiency of the cryostat machine. It also depends on the tissue itself. For example, fat doesn't freeze very well, and so the quality of sections will not be as great as a lymph node section. And it is also a problem when a limited number of sections can be taken because of the time constraints. So the quality of the reports may be compromised. There is also a situation where the histopathologist cannot come to a conclusion. In that case, we'll report to the operating surgeon that the frozen section is inconclusive. Kindly wait for the paraffin sections. So these paraffin sections are where the tissue is fixed in a fixative called formalin, subjected to tissue processing, and then the tissue is embedded in paraffin wax, and paraffin blocks are prepared out of the tissue. Then multiple sections are cut from this paraffin block and then subjected to detailed analysis. So now this paraffin sectioning will take anywhere between 1 or 2 days at least, and then however the accuracy as compared to frozen section is definitely better on a paraffin section. So one must remember that food which is cooked very quickly cannot be as tasty and healthy as food which is cooked very slowly, taking care to add all the ingredients and paying attention to the finer details.
Sir, does frozen section cause delay in the surgery and does it affect the patient's recovery?
No, as she said, it takes just 10 to 20 minutes. So it hardly comes in the way of the surgery duration. So it actually helps us out, but doesn't delay our surgery.
So, ma'am, to conclude, based on the frozen section report, can you give a final diagnosis?
Whether or not frozen section is done, final diagnosis is always given on paraffin sections.
So, sir, in case of a frozen section or paraffin section, what is done if it takes time?
During surgery, we rely only on the frozen section report. I would expect a mass to be cancerous or benign. If it is cancerous, then we proceed on to the definitive surgery. If it is non-cancerous, we have resected the specimen, we don't proceed further. We do not wait for the paraffin blocks.